Hi everyone. Today in this video let us discuss HbA1c test. What are the advantages and limitations of this test compared with other blood tests for diagnosis of diabetes? We will discuss in this video. So glucose is one of the essential molecules for the source of energy, but when these glucose levels are excessively increased, it can produce few of the symptoms in the patients, resulting in one of the condition diabetes. So with elevated glucose levels, we can observe increased thirst, unexpected tiredness, increased hungriness, increased frequency of urination. As the excess glucose can affect the eye, it can produce some blurred vision, increased risk of infections with increased levels of glucose, and finally it can also produce unexpected weight loss. All these symptoms can be observed with elevated levels of glucose in the plasma. So estimation of glucose is essential in order to assess any development of diabetes, but in few of the patients, we can observe asymptomatic phase. That means patients may not have any of these symptoms, but still their glucose levels are excessively elevated. So whether symptomatic or asymptomatic, the elevated levels of glucose levels always produce some damage to the major organs, so they should be strictly controlled. For that, we require the blood test for glucose, which should be easily available, patient compliant, and available at reasonable cost. So many tests are available for diagnosis as well as for estimation of blood glucose levels. Among them, FPG is one of the tests, fasting plasma glucose levels. Second one is the GTT, glucose tolerance test. And third one is the RPG, random plasma glucose test. Here, glucose tolerance test is one of the reliable tests. In this test, initially one blood sample is going to be collected and immediately a glucose liquid is going to be taken. Then another blood sample can be collected either at 1 hour, 2 hour or 3 hour. Generally at 2 hours, another blood sample is going to be collected and any excessive elevation of glucose is going to be detected at the 2 sample. Even this test gives reliable results, but this is one of the time consuming process and requires multiple sampling. And random plasma glucose test can be done at any time during the day, but it is not completely reliable because the glucose levels are highly variable with the food intake and other conditions. Finally, FPG, fasting plasma glucose, is one of the reliable tests for diabetes, and here the finger prick test is available which can be done within the home. So FPG is one of the easily available tests to assess the glucose levels within the plasma. But still FPG is having few of the limitations. So the patients who are going to take the FPG, they should maintain the fasting conditions. Food intake should be controlled for the last 8 hours. So 8-hour fasting should be maintained in order to assess the proper blood glucose levels. That's why FPG is done at the early morning without any intake of food. So any intake of liquids within 8-hour fasting may result in the increased levels of FPG values. Similarly, few of the conditions can also reduce the FPG values. For instance, any excessive exercise during the morning or use of any drugs such as anti-diabetic agents or insulin within these 8 hours can reduce the FPG values. So even FPG is a easily available test for a diagnosis of diabetes. It is highly variable with fasting conditions, intake of food and fluctuations of glucose levels. But in case of HbA1c, these conditions are not required. So in case of HbA1c, fasting is not required. So food intake will not influence the HbA1c values. Similarly, it can be done at any time. So not only the morning, at any time of the day, HbA1c test can be done. And this test is not influenced by the fluctuations of glucose levels within the day because HbA1c gives the average glucose levels for past 2 to 3 months. Actually, this test is not the direct measurement of the glucose. Instead, it involves the estimation of glycated glucose levels. That's why it is not affected by fluctuations of the glucose within the day and it is not affected by intake of the food. That's why nowadays HbA1c getting more importance in diagnosis of diabetes and pre-diabetic stages. So what is HbA1c? This HbA1c test can also be simply called as A1c test. So here A indicates the hemoglobin type A, which is going to be glycated with the glucose, resulting in the glycated hemoglobin. Now within the blood vessels, erythrocytes are present. These erythrocytes contain the hemoglobin. The lifespan of these erythrocytes is around 2 to 3 months. The maximum lifespan is 120 days. So up to 3 months, erythrocytes can exist within the blood vessels. Now during this lifespan, they are interacting with the glucose. The glucose molecules can enter into the erythrocytes where they can interact with the hemoglobin molecules. So by binding of glucose to these hemoglobin molecules, they form glycated hemoglobin. But here, all the erythrocytes are not glycated. We can observe few of the erythrocytes which are non-glycated. So HbA1c test identifies the percentage of glycated hemoglobin versus total hemoglobin present in the plasma. So this is the erythrocyte which is having hemoglobin molecules. Now glucose can enter into the erythrocytes and it can bind to the hemoglobin. But in order to enter into the erythrocytes, they should express one of the transporters. They are the GLUT1 transporters. These are the transporter for the glucose. Now glucose within the plasma can enter into the erythrocytes through these GLUT1 receptors and it can bind to the hemoglobin. But the binding of glucose with hemoglobin depends on two factors: the availability of hemoglobin as well as rate and extent of glycation. So HbA1c is measured as a percentage, which is a ratio of glycated hemoglobin levels divided by total hemoglobin levels multiplied by 100. So this is the percentage of hemoglobin that is going to be glycated with the glucose will give the HbA1c values. So any modification of hemoglobin, for instance, in case of hemolysis, hemoglobin may be lost. In such cases, the HbA1c values may be reduced. Similarly, in the modification of glycation, again HbA1c values are modified. So when these two factors are not variable, HbA1c gives a good indication of average plasma glucose levels for past 2 to 3 months. Now let us see what are the HbA1c levels. The normal levels of HbA1c are less than 5.7%. So in such patients, we can consider the glucose levels are under control for past 2 to 3 months. But sometimes few of the factors may reduce the HbA1c values, which should also be considered. Similarly, the people with pre-diabetic stage, the HbA1c values are variable from 5.7 to 6.4%. So in such patients, caution should be taken in order to reduce the development of diabetes. So control of sugar intake and proper exercise conditions can reduce the development of diabetes. Third one is the diabetic stage where the A1C values are greater than 6.5%. Again, in such patients, proper diet and exercise should be maintained along with use of anti-diabetic agents based on elevation of A1C values. Now let us see the limitations of HbA1c test. As we have discussed, HbA1c values depends on the rate of glycation with hemoglobin. So it depends on the availability of hemoglobin as well as the extent of glycation. Normally the lifespan of erythrocytes is 2 to 3 months. But when the levels of RBC are going to fall, it reduces the hemoglobin levels, resulting in the decreased HbA1c values. So if you have the conditions like multiple blood transfusions, severe blood loss, or some of the disorders like chronic renal failure, where hemolysis results in the loss of RBC, all these conditions can reduce the HbA1c values. So in such patients, we can observe low HbA1c even with elevated levels of glucose. Similarly, in conditions like liver failure, we can observe decreased HbA1c values, or in the patients with anemia, again HbA1c values are reduced. Even the conditions like pregnancy can also affect HbA1c values. When the bilirubin levels are excessively increased, it can increase the glycation process, so it can elevate the HbA1c values. In this way, abnormal A1c values can be produced by many of the conditions which should be closely monitored. Even HbA1c is variable with the ethnicity. So different population may have the different types of hemoglobin. So in this HbA1c, hemoglobin type A is going to be used for estimation. But in the people with different geological areas, hemoglobin types are variable, which may modify HbA1c value. And even few of the drugs like opioids and anti-HIV agents can reduce the RBC cells, thereby they can affect HbA1c value. So all these factors should be considered in assessing the diabetes by HbA1c test. Even with these limitations, HbA1c stands as one of the good tests for diagnosis of diabetes and pre-diabetic stages because it is less variable with food intake, fasting conditions, and fluctuations of blood glucose levels. So what is the goal of HbA1c? The goal of HbA1c is mainly observed in the diabetic people. So in the patients with diabetes, the HbA1c should be maintained less than 7%. So why it should be maintained less than 7%? Because HbA1c can be converted into estimated average glucose levels for past 2 to 3 months, which is simply called as EAG. So with the patients with HbA1c as 7%, the EAG values are equal to 154 milligrams per deciliter. So it is always better to control the average plasma glucose levels with less than 154 for past 2 to 3 months in order to maintain good lifestyle and to avoid further development of diabetes. So the goal of treatment in the diabetic people is to maintain the HbA1c values less than 7%. So that's about this test HbA1c, which is somewhat more useful compared with the FPG. Even FPG is easily available at low cost, but still it requires strict fasting conditions and it is variable with fluctuations of glucose levels. But HbA1c test can be done at any time and it is not influenced by fluctuations of glucose levels or fasting conditions, and it gives a good indication of the average plasma glucose levels for past 2 to 3 months. So that's about this test HbA1c. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.